Well, it's Wednesday, and every Wednesday, Tobago Talk, and when Tobago they talk, we listen. We welcome this morning the Secretary charged with the responsibility for health, wellness, and social protection, Dr. Faith B.Yisrael. Good morning, Dr. Faith. Great to see you as always.
Good morning, and thanks for having me this morning.
Of course. Thanks for the time. I want to find out what's the response like in Tobago, what's the conversation concerning COVID, just reminding people to stay safe. I know it's not only Carnival around the corner, but it's also cruise ship season. The cruise ships, they have been coming, and people are coming out and enjoying the island. What's the conversation like? What's the push from your particular standpoint to just keep people on the P's and Q's there in this style?
Certainly, and yes, we are very, very thankful that we've had what we would class a bumper cruise ship season. We've had ships coming in, several per week coming in, going up to the end of January is the schedule that I have seen thus far. So we're really happy about that. And of course, we just came out of Christmas, going into Carnival. We would remember a couple of weeks ago, the Prime Minister and his technical team, they came out and spoke about the fact that we have this new sub-variant of Omicron that is moving around, that we need to be a little bit careful of. He did not announce any shutdowns or anything like that because of what we are seeing with that sub-variant. And let me explain. That sub-variant it's pretty infectious, meaning people are getting infected, but they are not getting sick the way we thought of COVID very early, or when we had Delta, when people were getting very, very sick, had to go into the hospital and were dying a year or so ago. As a matter of fact, what we've recognized is that most of the people who we identify as having COVID really came into the hospital because they broke their arm or some other reason. And because we are still doing routine COVID testing in the hospitals, we picked up, hey, this person who came in with a broken arm, they have COVID. But they did not come with any, runny nose or anything that showed that they had flu-like symptoms or anything like that. So because of all of these things, we're looking at the numbers. We are just encouraging people to continue doing what we've been telling you to do. Wash your hands, again, soap and water, because the soap actually kills the virus. By the way, when you wash your hands, that is killing all of the other stuff that, the bacteria and E. coli and all of the other things that we need to be concerned about as well. Definitely keep sanitizing your hands. Definitely, if you are one of those people who are vulnerable and you are probably going into a crowded area, or you just don't like the idea of being out there without your mask, please keep wearing your mask. We are encouraging you to keep wearing your mask. If you are feeling sick, then definitely stay home, definitely stay away from people. The vaccines are still available for those who still want to take them or those who want to get boosted. So those are the things we're encouraging people to do, but still be careful, because it's not gone yet, but we are getting to the place where we're not even talking about it as much.
Well, I've recognized that because, Dr. Faith, I mean, granted, you use your platform as always to inform and to remind folks, which we appreciate, but I was watching the press release that came in where even the briefings in Tobago discontinued. You all decided early January to do away with that. Is it based on a low, what's the numbers like in Tobago, really and truly, for those who don't know?
Right, the numbers are actually very, very low. We have an average, maybe 1 or 2 official cases being reported officially. But of course, that's not just because we have only 1 or 2 people with COVID, because those are the people who we happen to test. People are just not getting tested anymore, again, because you're not really getting sick. A lot of people are not finding a reason to be tested. But yes, we did discontinue the public notices, though, but be mindful. We are paying very, very close attention to the numbers in the background. Every night, I still get the record of what the numbers were for the morning. And we huddle with our technical team to determine where this is going, what's happening, what do we need to beef up, and so forth. So we are still paying attention to it. We just wanted people to not, we realize that when you see something too often, you get desensitized. So what I've been telling the folks in Tobago is, yes, we stopped giving you the reports, but this is if you do see us sending out a report from the Division of Health, Wellness and Social Protection or the Tobago Regional Health Authority. know that you need to stop and pay attention to that report, because we're only sending it now because we want you to pay very, very close attention to the information we're giving you. But we are looking at it very carefully in the background. We are doing the analysis with my office of the CMOH and so forth. We are doing all of the preparation, continuing preparations to make sure that the hospitals are still in a space just in case we get more cases, and that our health centers, that our doctors and nurses and all the professionals are still using the protocols that are required. We are still going through that stuff in the background, just in case. But you know, we are telling people, you don't be worried too much, just still be careful.
Let me ask you, for those coming across to Tobago, they have not been for quite a while. I've not been myself. Is the momentum with the masks still very much relevant? What's the general feel on the ground? Private sector, businesses asking people, is the THA official government offices requesting masks to be worn while conducting business in Tobago?
So the only official space where you must wear a mask is in the health facilities for obvious reasons, because that is where, you know, infections run around generally. But in all of the other spaces, there are a few places where you go in and you still see people. I actually still see quite a number of people walking around with the mask. Funny enough, I see a lot of people walking around with the mask under their chins, which I don't understand. I think people have just gotten so accustomed to having the mask under the chins, they're still doing that, which doesn't make sense. If you're wearing it under your chin, don't wear it. You know, but most places do not require you to wear it, but there's still got quite a number of people who are doing it.
What plans of action in place for Carnival? Because, you know, there are those who would come to Tobago to escape the excitement of Trinidad. There are those who will want to come and experience the Tobago Carnival, and just those who, as always, will come forward to conduct business. So I'm sure that particular timing, the island will be very busy. What's your advice in that regard?
And yes, and we are encouraging all of the categories of people that you just spoke about to, yes, come to Tobago for Carnival. Please come to Tobago to experience the Tobago version of Carnival. Come to Tobago to go to camp. Come to Tobago to just get away from all of the bacchanal that happened in Trinidad. Yes, please come to Tobago, the greatest little island. I sound like an ad. But yes, you know, we are just telling you to be careful when you come. And still wash your hands, still wear your mask if you want to wear your mask. Still sanitize. Definitely, if you've gotten vaccinated or if you're still interested in getting vaccinated, the vaccines are there. Go get your vaccines and so forth. You come and enjoy the beauty of this island. Come to the beaches and all of that, because that is what we want. That is how we are able to have our businesses thrive. You know, for example, we saw that coming out of Carnival in October. We had a massive grouping of people coming to Tobago, and that did a lot for our business people. And that is what we need to continue on the island at this time. So we are encouraging everyone, come. There's nothing to be afraid of. We are well prepared here, and we are just encouraging people to come and be safe around that time.
Interestingly, I just want to move away, and I want to thank you for that. I just want to move away a little bit from the COVID conversation and just talk about general health and wellness. So we always hear there's strong and there's Tobago strong. So we know that folks in Tobago, primarily, especially old school, very organic in terms of, you know, the roots food, and we see many who would have lived to some really long years, really long years, strong and healthy. As we look towards the now generation, what seems to be the thrust from your particular, you know, office? I know that in Trinidad there are issues with hypertension and cholesterol and the way we eat and that kind of stuff. What are some of the general, outside of COVID, some of the general health concerns and some of the plans of action to just help people to just kind of adjust a little bit of their lifestyle and probably diet?
You know, that is so critical, because during COVID, we kind of forgot about everything else. We still have all of the non-communicable diseases where we still have some of the highest rates right here in Tobago. Diabetes. I'm sure if you ask every single person you know, do you know somebody with diabetes? Everyone will put up their hand, which tells you how many people have diabetes. High blood pressure, same thing. We're seeing some of the cancers coming up. Same thing that you know, the Caribbean is experiencing, Tobago is also experiencing. I've actually started talking with some of my technical team for us to start rolling out some of the exercising programs that we were doing before, and some of the other healthy eating programs that we were doing before, and so forth. Now, another thing that we are looking at in Tobago, we're not just looking at it, we've started the process, is actually trying to use those, the old school foods, the root foods, the dashins and the cassavas and so forth. We are really making a push to transform those into cereals and into flour and so forth, so that we can bring them back into the diet in a way that, as you say, the young people might want to use them.
And based on that, would you say young Tobago, the now generation, is eating different compared to, let's say, their parents and grandparents?
Well, I think we are all eating different now, because we have access to so many other things that we did not have access to. We now have way more options that we did not have before. Before, if you had to walk to go to town to go to a fast food restaurant, you're not walking to go to town to go to a fast food restaurant. Now you could just jump in your car and you have 10 options right there. And in some instances, it's actually cheaper to do the fast food than to do the other foods. So we are all, not just the young people, I think we are all eating differently now. And that is why we have to figure out how to get back to how to modernize some of the things that we were looking at before, some of the things that we know are healthy for us, but not as attractive, and modernizing it. So if you go to the TADCO, Tobago Agricultural something company, I can't remember what TADCO stands for, you would see that we are now offering, for example, individuals are offering, dasheen cereal, cassava flour, doing stuff with breadfruit. So, we're making it into a nice package, and you can actually find some of these products on the shelves in Tobago and on the shelves in Trinidad and so forth. So it's a way of modernizing the old school food, ensuring that we still maintain the nutritional value of those foods, but still ensuring that we eat healthy.
Dr. Faith, I want to thank you as always for your time, for really breaking it down, letting us know what's the latest out there in Tobago. Yes, and as I said, if there's one thing I've always known about Tobago when it comes to cuisine, because our family there, really good ground food, your porridge. I can't remember the last time somebody in Trinidad drink porridge in the night. These are things that's synonymous with Tobago. So I'm happy that you're all kind of finding ways to bring it back in the conversation and let the now generation enjoy some of the benefits of, I would say, the real grounds food. Good food.
Yes.
All right.
Good Tobago food. Thank you for having me.
Always. We'll touch base soon.
All right, bye.
That's Dr. Faith there, out of Tobago, Secretary of Health, Wellness and Social Protection on the Sister Isle for Tobago Talks. Up next, we get you ready to party with the hearts. It's happening on Friday. Full details. This is going to be truly amazing. We welcome the principal of Sacred Heart Girls RC to give us more details concerning their event this Friday. She's up next.